Okay, so for all of our mandibular and our sinus shots, we're going to be doing them on an 8x10, and it's going to be collimated to the area of interest. Our tube is going to be at 40 to 48 inches, and we're going to make sure that we shield the patient. Okay, so today we're going to do a mandible series, and I am all set up with my room, and I'm going to go get my patient. Katie? Hi, can you tell me your last name?
Hammer?
And your date of birth?
9/17/90.
Okay, what happened?
I fell and hit the side of my chin here.
Okay, all right. So we're going to have you stand right over here. Is there any chance you could be pregnant?
No.
No? Okay, good. So I'm going to have my patient stand in the PA position. I'm also going to shield her. I'd ask her to take off any earrings or bobby pins and make sure her hair is down and preferably not wet. So she's going to stand here, and we're going to center her to the Bucky. The AML, we're going to do the PA for her body. The AML is going to be perpendicular, and my beam is also perpendicular. And the beam is going to exit out the center of her lips. So now we're ready to do our obliques. She's going to be positioned in an RAO, and her head's going to be a lateral, but then we're also going to tilt her head 30 degrees toward the IR. The side closest to the IR is going to be the side of interest. And then we're going to angle our tube 25 degrees cephalic and make sure she's all centered to the IR. So after the RAO, we would do the LAO to get the other side. Then the next position that we're going to do is called the SMB, submento vertical position. And we're going to lower our Bucky. I'm going to ask Katie to sit onto this stool. And I'm also going to lower my tube. The vertex of her head is going to be at the top of the IR. So she's going to lean back and tilt her head back. And then, so her IOML is parallel and her with the IR. And we're going to be centered at 3/4 of an inch to the level of the EAM. So now that I'm all done with the mandibular series, we're going to evaluate our images. We have the PA here, which shows your mandibular body really well. Our next one is our oblique. We did both obliques. And this one shows the body and the rami. And just another image, this is the other oblique. Again, you can see the body. The last one we did was the SMV, and that one is more for the coronoid and condyles of the rami. And for the techniques for our mandible series would be 75 kVp and anywhere from 5 to 12 mass. So now we're going to do a sinus series. I'm going to start her off in the PA axial position. And this is a Caldwell method. Her mid-sagittal plane is centered to the IR, and her OML is 15 degrees cephalic. And this CR is going to exit right at the nasion. The next position that we're going to do is the parietal acanthial view. It's called Waters method. For this one, she is also going to face the board. Her chin is going to be on the board, and her OML is 37 degrees to the IR. Her mid-sagittal plane is centered to the IR. The tube is perpendicular, and the beam is going to exit the acanthion. The next position is a lateral. So my patient is going to be in a LAO, because we usually do a left lateral for most things. Her mid-sagittal plane is going to be parallel to the IR, and her interpupillary line is going to be perpendicular. The tube is also perpendicular, and it's going to enter halfway between the outer canthus and the EAM. Okay, our last position is the SMV, submento vertical position. It's a really hard one for the patient to do. The vertex of her skull is going to be touching the IR, so she's going to lean back and put her head on there. So that means her IOML is parallel to the IR. I have a perpendicular tube, and the central ray is going to exit 3/4 of an inch anterior to the level of the EAM. So for the sinus series, the techniques that I would use would be anywhere from 70 to 75 kVp, and then around like 10 to 20 mass. Okay, so we just did our sinus series, and now we're going to evaluate some images. The first one we have is the parietal acanthial view, which is the water's view. And this one here, we want to get the petrous ridges right out of the maxillary. They're going to be right below the maxillary sinuses right here. And then you can also see your orbits and your frontal sinuses right here. For the next one, we have the PA axial Caldwell. And this basically looks for the frontal sinuses again right here. And you can see the petrous ridges fill up the orbits on the Caldwell. The next one is our lateral. This one you can really see all 4 sinuses, and you can really tell it's a true lateral by the sella turcica being completely visible lateral, and then your orbits are superimposed over each other. So you can see all 4 sinuses with this one. And then we have another view that my site doesn't do, but you can also do it. It is the SMV, submental vertical projection, and this is actually for the sphenoid sinuses, and you can see air fluid levels in this one as well.